Good morning and welcome everybody. It's Isaac here at Tidewater Management Group. Thank you very much for joining us this morning. We know it's a busy time of year, but we want to make sure that our agent partners were both aware of the Medicare Center platform, what it looks like, and to have a good understanding of it so that we're prepared for this AEP and the AEPs moving forward. So again, my name is Isaac Guerrette. I'm part of the agent support team here at Tidewater Management Group. Everyone is going to be muted on this training. However, there is a chat function, so if anyone has any questions, feel free to use that and we'll be happy to respond to you. And again, if we miss anything throughout this training, we'll respond after the event as completed. So again, today we're covering the Medicare Center 101. So for a lot of folks that are already using Medicare Center, thank you very much. But for folks that either haven't used it or it's been a few years since you were first introduced to it, or it's been a while since you've actually had a chance to check in, or if you're new and haven't had an opportunity to actually register and take advantage of this system, this training is for you folks here. So thanks again for everyone for joining, and for me and everyone here at Tidewater Management Group, I want to send a heartfelt thank you to each and every one of our partners. Again, we wouldn't be here if it wasn't for you folks, and it truly is a partnership. So we appreciate each and every one of you and all the hard work that you do. Again, we wouldn't be successful if you weren't. So again, if anyone has any questions, feel free to use the chat, and then we're going to go ahead and begin here. So first and foremost, with Medicare Center, if you haven't registered already, again, this system is available to any agent partner of Tidewater or any Integrity partnered agency, an agent that's contracted with them. You need to have at least one Medicare Advantage contract to be able to have access to the system. However, you can register prior to. But you will be able to see, quote, enroll, and manage any Medicare Advantage, MA only, PDP, DSNP, and in some cases CSNPs, that you have contracted with us within this system. So it is a single sign-on portal that allows you to complete all these steps. And again, you can create profiles, you can save drug lists, which is really nice. You can do plan comparisons, you can send scopes of appointment, you can actually do the enrollment as well, and everything can be done both face-to-face or remotely, provided that you are certified and ready to sell for the carrier within that state. So again, we're going to start here. For anyone to be able to get access to Medicare Center, all you need to do is go to www.medicarecenter.com. It'll bring you to this page here. Again, if you have yet to register, go ahead and do so now. What this will look like, basically you're going to register your NPN number, first and last name, a good email address that you can access, as well as your contact number that you want members calling, whatever phone number that you've used for marketing purposes, because you'll notice that number is then provided when a member is actually going through this system. And so if they ever have any questions, they can reach out directly to you at the best form of contact. And then also create a password. Once you do that and click register, an email will be sent to the email address that you provide. There's a little button that says verify registration. Go ahead and click that button. You have to do it within 2 days. I recommend doing it right away when you receive it. When you click that button, you should then have a pop-up screen that says you're all set. You can now log into Medicare Center. If you receive an error message that says that the link has timed out, all you need to do, and I'm going to take my cursor, let's say that you have this imaginary button here that you're clicking in the email and it's giving you that error. If you right-click on that button, it'll give you an option. Let's see here. So it'll give, like this, for instance, when you right-click on it, it'll give you an option to open link in new tab. So when you're in your email at that button, right-click on the button and select open link in new tab, and it'll pop up and that'll override the system. Again, if you have any issues, any concerns, comments, or are struggling to be able to get registered, feel free to reach out to myself or your direct point of contact here at Tidewater, and we'll be happy to assist you there. Now, it's key that anyone that wants to be able to use this system, make sure that you are registered as soon as possible so that you have access. And the reason being is it can take some time for all of your carriers to populate, or if, for instance, you've added a carrier recently, we need to ensure that you have access to that system. And if for whatever reason you do not have a copy of that, if you do not have access to that carrier, we need to know as soon as possible, because it can be a longer, it can take a couple weeks in some cases from the time that you actually receive your ready to sell status before we can actually go ahead and upload this information. Great question from one of our agents. Will you need to do anything to reactivate if you have used in the past? So if anyone has used this system when we originally introduced MedicareCENTER, I believe it was 4 years ago now, if you hadn't done the change in 2020 and registered in this platform, you'll need to do so. If you have registered at any time after 2020, no, you do not need to re-register. You simply go ahead and log in. Again, if you can't remember your login information, the username, it's always your NPN. The password, you can go ahead and request a password reset. Other thing about logging in, I think if you enter your incorrect credentials 3 times in a row, it's going to lock you out. What it'll do is it'll actually say that either reach out to your upline or reach out to the tech teams for support. You don't have to do that. It actually will unlock 60 minutes from that point. So if you end up locking yourself out, wait an hour, go ahead, and when you get to re-access the system, and instead of trying to enter the information, I recommend going just requesting to reset your password so that you can go ahead and get in there, and then you'll be able to log in from there. So as said, we're going to go ahead and log in once you've registered. And today, there's been a big update, and we will discuss it in a lot more detail in the upcoming trainings. However, we are happy to announce that the agent phone number and recording systems have been launched as of this morning. Again, we're still trying to go through all the particulars, and for lack of a better term, I'm going to have to get in there and try and break it to make sure that we can overcome any technical issues that some of our agents may run into, or kind of do's and don'ts to make sure that you folks are as efficient as possible when using this service. But it is going to be live, and this is something that's going to be provided to every agent partner that has access to the system at no charge so that you can use it and be compliant during AEP this year. Now, there are a bunch of other updates that are going to be coming through on 10.1 that we're going to see within this system, and again, we're going to discuss those updates in a lot more detail, really in week 3 and 4 of this training series. Again, we're just going to talk about the overview today, but I can't disregard a pop-up like this. Everyone that's going to log in today will get this notification here announcing that your phone number now is live, and everyone will have a unique phone number dedicated to them. And basically by clicking Get Started and View Account, you'll actually see your phone number. You'll see the option to be able to toggle on and off. And the great thing about this is it automatically records all inbound and outbound calls from that phone number. And it will then open up a window when a call is initiated, giving you the compliant disclaimers that you need to read, and then it'll prompt you based on the member's statement whether they want to, or whether they consent to being recorded moving forward, or if they want to retract that consent and do not want to be recorded. You'll actually have a button where you can select either they consent or stop recording now. The good news is that everything is going to be saved up to that point and added into that member's profile so that you're compliant and you can continue on. Again, we'll talk about that in much more detail here coming up. But I just want to kind of show everyone what to expect. And so now with this pre-update, basically, it brings everyone into the dashboard here, which we're familiar with seeing. You can see contacts and information here as well, and our Learning Center. Sorry, let me reload. Go ahead and go away. Now, everything is really going to be starting to move towards using our CRM, which is what we see here. And you can either access it, you can see recent activity in your dashboard, or by going to contacts, we're now within the CRM. Basically, from here, you can upload or import your existing book of business. And what you can do is pull that information from your either a CRM that you're using or from your carrier portals. And by selecting import, what you'll see here is it'll actually give you the items that you can then upload into this system. The cool thing about this is it basically cuts down on data entry up front, but you need to be particular about how this stuff is formatted. I was actually helping an agent earlier this week about trying to get an upload that was having error messages, and basically the formatting was a little bit off, I believe, for the, I want to say it was the state or the county that they were trying to update. They were using abbreviations, and that was causing the issue. So it is fairly simple to be able to resolve. However, just keep in mind that you do want to keep it in that format. And if you ever have any questions or need help with that formatting, a really good thing to do is go ahead and download this template here. By selecting this, it'll prompt you to go ahead and download at whatever location you would like. And I'll show you folks what this looks like. and this is going to be a CSV file. So this CSV file will look just like this, where it actually gives you the different information that you can go ahead and enter, and then they give you an example to be able to have. And so again, you can pull that information from your existing either CRM or from your carrier portals and load this using the information that's requested. Save that to your desktop, and then all you'll need to do is basically go ahead and drag and drop from your desktop into here and select update. I believe it was taking an overnight update to then reflect into the system. I don't believe it is immediate yet. I haven't tested it out since this launch this morning, so that may have been changed, but keep in mind it may take overnight before that information is reflected. And again, it's not going to be a complete data import, right? So if you have members, drugs that you've saved, or additional information, doctors, things like that, you can add it to the notes, but really I'd recommend just saving or holding off on that until everything's uploaded and then going within that member's profile and entering that information from there. Again, like I mentioned previously, this system allows you to text and email scope of appointments and enrollments. It also has a passive enrollment system. Basically, it's called your PURL, personalized URL. That can be included in your email signature. It can be on your website, or you can share it to your agents. I'm sorry here, I was missing some of the questions. Will there be an overview as to how to conduct a completely compliant call, for example, calling leads or those who have responded or requested information? That's a great question. Yes, we will be providing a lot more information on the compliance. Again, there's still a lot of questions up in the air. I know some carriers yesterday made some definitive statements, but we still have a lot of questions that we're waiting to have answered kind of before we go that. So, we appreciate everyone being patient with us. Again, we're learning this at the same time that you folks are, and I don't want to preemptively offer information that's going to be either incorrect or we have to go in a different avenue, because right now there's a bunch of different ways that we see that we can compliantly handle the new rules and regulations. However, until we get definitive answers on some of our questions, I don't want to kind of steer people down necessarily the wrong path or a less efficient path until we have that information. But yes, we will be providing that information. And who will be able to import from Excel and pull old leads to prospects? That's a good question as well. So it's anyone that has access to your portal is the individual that can go ahead and either upload or pull data from here. Again, Integrity has purchased secure cloud servers to store this information. Now, I've been told that we are not selling any of this information to third parties. We're not cross-selling. We're not using those as leads from the data here. Again, we're just providing a secure cloud server space at no charge to our agent partners. And again, this information is retained for a minimum of 10 years per compliance requirements that can go ahead and then be removed at that point, but they can always be retrieved once the information is in here. From year to year, we've seen that old applications, SOAs, and some client data may be removed when an update comes through. That data isn't lost. You just need to reach out to the MedicareCENTER support team and request exactly what you're looking for. So let's say that you're looking for a Mr. or Mrs. Jones scope from 2 years previous that you had done through the system. You just reach out to them, let them know their first and last name and what you're looking for, and it can take, I think, 24 to 48 hours for the team to be able to pull that and get that to you, but it is retrievable. Great questions there. If we have clients stored here that are not in the contact list, how do we move them into the contact database here? So again, I'm still waiting on a response from the support team. I'm hoping that there can be a data import from Medicare app and Medicare Link if you already have information here to move over. Again, we'll cover that in a lot more detail next week and moving forward. But for right now, keep in mind anything that you have in this system is retained and we can access it. I'm just waiting on some of the specifics there as well. And again, like I said, with updates that have to come out on 10/1, the reason that we have to do that is we're waiting on carrier information and they will not provide it to us before then. So we're kind of stuck and holding on to that point, waiting to then do the upload, and then we have that information. So it's kind of a last minute thing. So again, I appreciate everyone's patience with that, but we will be providing that information. And again, it's, we're all in this together. So as we're all learning, we are going to be pushing that information out. the big concern for not just me, but everybody here at Tidewater is to make sure that we're providing accurate information. So not necessarily just quick information, but making sure that everything that we're providing is accurate. And sometimes that can take a little bit longer so that we can, double and triple check to ensure that what we're providing you is up to date. So good questions there as well. So again, download, you can update, and then that information is populated into your contact section. People refer to it as the CRM. You'll see in some marketing campaigns as well, both from Integrity and Integrity partnered agencies, including Tidewater. That's where you'll end up seeing that, where we're talking about the CRM. This is what we're discussing here now. And from here, there's going to be a lot more with updates on 10.1. There's going to be a lot more user interface accessibility. It's going to be easier to see everything. There's going to be more functionality for filtering and pulling reports, and a ton of more stuff. And again, we'll talk about that in more detail here. But for enrollment purposes, again, whether it's face-to-face or over the phone, you can simply, if you don't have a client here already, you can simply add new, create first and last name, date of birth, enter an email address. Oops. Oh, email address. There we go. I was adding my actual email address. There we go. That makes more sense. There we go. We're going to say primary communication, and then there. And then you can actually, and it already notifies you, which is nice because the system is an intuitive system. It notifies you that contact information has already been created at some point. You're making a duplicate, which is nice, and it'll direct you to that link. A cool feature with this CRM, which has been different in the past, is you can actually delete duplicates or delete contact records if needed. Again, make sure that you're only doing that if you're absolutely positive that you have a duplicate, because once that's deleted, that information is gone for good. Again, have clients already entered in the past but still retained in our portal? Yes, it will be. A question was brought up yesterday. What if they do not have an email address? So for you to be able to use the system, the member has to have either a smartphone, cell phone number, or they have to have an email address and internet connection to be able to do so. If you're sitting face-to-face with a member, you can do that. However, all the supporting documents for compliance is sent to that member via text or email. So again, you can provide paper copies of the summary benefits, star rating, any disclaimers, and collect a paper scope in those instances. But again, it is a lot easier if you can do everything online from beginning to end. But again, it does give you some customization there and user ability to work with folks that either are in areas that have limited internet connectivity or still have landlines, basically because they don't have self-service or internet connection or something like that. But as of right now, they have to be on, or you and the member have to be able to connect online to be able to send a scope and or enrollment, unless you're sitting face-to-face, where you as the agent still need to be connected online to be able to use this system, but you can complete the application with the member sitting right there. You turn it to the member to review the information, and then go ahead and they can sign right on the screen. And again, yes, we will be having trainings every Thursday this month. And again, we're going to get into more and more detail for every single training. But this first one, we just want to make sure that everyone's familiar with the system, knows how to register, and has an opportunity to do so. Let me circle back to when I was originally discussing making sure that you have access to your active selling permissions and all your carriers. To be able to do so, when you first log in, you're going to select your name. And again, I'm using Todd's account so that we can see this. You hit account. It'll bring you to this information here where you can change your password. You can update your contact information. And this will actually, at the very bottom, will show the active selling permissions that you have. So it'll give you carrier, states, plan type, plan year, and then the ID associated with it. So if you see in there, or when you check your portal and profile and see that there's missing information, or you're missing a carrier, whether it's just for a state or an actual carrier in total, reach out to us, let us know as soon as possible so that we can work on getting that manually added or uploading a new report to ensure that you have it. Because like I said, there can be a slight delay from the time that you're ready to sell before it shows up on a carrier report that's then sent to us that we upload to then give you active status. So the sooner we can get that done, the better, but that's something that we can manually fix as long as you are ready to sell with that state. To be able to access the other enrollment engines that are available in this system, if you hit your name when you've logged in, you can see Medicare app and Medicare link and then CSG app. So you have the CSG actuarial app, which will have a bunch of features, which will cover in a different or in a future training. But we do have Medicare app and Medicare link, which are active enrollment systems within this portal that you have access to right now. And a lot of folks that have used this system in the past or have seen some of my trainings in previous years, you're going to be familiar with seeing both Medicare app and Medicare link. Basically, these two systems use different enrollment engines, engines that people are probably going to be familiar with. They've either dealt with at different times or have dealt with directly with carriers. However, there's a lot of proprietary technology attached to both of those systems that Integrity has created. So it's not as if you can go directly to Connection or you can go directly to Sunfire and get access to what you see here. The base enrollment engine is operated by them. However, all the added bells and whistles and resources and user interface specialization or customization is thanks to Integrity. And that's, again, something that you can only get through this partnership, but at no charge to you. So to be able to access Medicare app or Medicare link, which is, again, the systems that are currently active, that members or agents have used previously, this is where you can see that member information. Again, you can search for profiles in here of our existing clients. You can, I'll show you here on a profile that I've created previously. I'm going to start typing my last name to show you. And again, you can see where all of these are populated. You can see email addresses, mailing address, all that information there as well. Okay, and if I want to use the CRM for clients without email, will I be able to enter their info into the CRM and get the birthday reminders and that type of thing? This is for face-to-face clients without. Understood. Yes. And so, again, this is not a required resource, and you don't have to use all of the available tools within this resource to be able to have access to it. What I tell both our partners, and every time I do a training on this, it doesn't matter what you're doing, whether you use your own CRM or you use your own enrollment tool, there is something in this system that I believe every single agent that deals in the Medicare space can benefit from. Again, whether that's just saving drug lists from year to year, so instead of you having to re-enter that information, it's retained in there for you, or whether you want to send e-scopes or you just want to have notes and reminders like that agent was just mentioning, you can do so. If you just want to use this to be able to pull copies of the required documents. For instance, if you need to get a summary of benefits or an evidence of coverage for a specific plan, instead of having to go to the carrier, log in, figure out where those products were hidden from year to year, you can use this system, get access to basically run a quote for the zip or the county that you're looking for that plan. Then when you get to the actual quote, you can select plan details, and down at the bottom of those pages, they have all of the actual required documents that you can pull and actually download. So if you need, like I said, pull a summary of benefits, star rating, and evidence of coverage for a plan to let's say, for instance, that Mr. and Mrs. Jones reached out to you and wanted to know what their plan covers or how does their plan cover a specific scenario for this specialist of chiropractic, whatever that may be, where you really need to refer to that evidence of coverage. You can pull that document very quickly and be able to search it out and have that answer, or again, you can copy that or attach it rather to an email and send that to the member as well so that they have that. So again, it's not as if you have to use all the functionality of the system or nothing. There's a bunch of in between as well. Again, it isn't required. You're more than welcome to use the other systems that are available by the carriers or if you're using a system as well. But we can tell you that, again, this is at no charge to agent partners. You get full commission using this system. All of the HRAs this year, when I say this year, starting 10/1, will be available for 2023 within this system. That includes United Healthcare. So if you're talking about Aetna, Humana, WellCare, United Healthcare, Cigna, some of the local shops as well, they're all going to be available on this platform to be able to complete. Look at some of our questions here. So one of the agents was asking, can we export our Medicare Center client list to an Excel spreadsheet to use for direct mail? If the information is in the CRM, yes, you'll be able to do so. The export function for Medicare app is limited, and I don't see that changing anytime soon. You can't get all the data there. Like you can see, I can download results here and have it in a spreadsheet, but again, it's only for what I searched. So if you wanted to search, let's say, 1/1 effect or 1/1/2022 effect is, let's say that you wrote about business through here for during last AEP, you could search that way and pull those effectives. But there isn't a method currently for Medicare app where you can pull a full list of just profiles that you've created to then export. You can pull a list of applicants versus prospects. Again, it can be a little tricky on understanding where you might be missing folks. But again, on the CRM side, starting 10/1, you're going to have a lot more functionality where you can pull a lot more data from that. It's a great question. And yes, there will be, this will be recorded, and it will be in our university, in our VIP portal next week. Our future trainings will have basically 2 times that those will be available, but the primary one will be every Thursday where we're discussing that information. And again, if anybody has any questions or need to see something, again, we're always available, whether you reach out to me or any of the Tidewater staff to help you with those things here as well. So good questions all around. I want to show you quickly kind of what I was talking about here. I'm just going to pull up one of the temporary profiles that I've created. Again, you can see I've saved all this information in here. Started an app, and what you can see here is it actually shows you the history. Because it shows continue enrollment, that indicates that the enrollment wasn't completed. What I need every agent to understand is if you're going to use this system and you submit or think that an application has been submitted, go back to the client profile for the system that you use, whether it's the CRM, Medicare app, or Medicare Link, and ensure that there is a confirmation number here in enrollment history. If you do not see a submission confirmation number, it means that it hasn't been provided to the carrier. But if that number's there, I can guarantee you up to this point, and it's been almost 4 years now, well, four AEPs, as long as we have that confirmation number, we've been able to ensure that the app is placed by the carrier, that you're agent of record, and that you get paid. If it isn't there, basically it wasn't submitted to the carrier, and we don't really have a leg to stand on. But again, if you see a submission confirmation number here, we can ensure that everything is placed appropriately, that you're agent of record and approved, provided that you are licensed with that product in that state. And again, will we be able to do the HRA for all carriers in MedicareCENTER? Absolutely. Starting 10/1, every carrier that is offering an HRA will be available within this system, provided that you've done any of the additional trainings that the carriers require. Not all carriers require it, but I do know that a few require a brief secondary training to then have access to their HRA program so that you can get paid for it. But yes, it will be available here as well. Okay, and so we have a question. If we have clients stored, let's say, in Medicare app or Medicare Link, how do we get that information to the contact database? I'm still awaiting a definitive answer there on exactly how we're going to get that information over. So more to come. That is a great question. Again, manually entering or doing a bulk upload from your carrier portals is one way to do it. I'm working on hopefully a more efficient way that we can do so, but I haven't got a definitive answer there yet. So sit tight, but that is a great question. And then Logan, thank you, Logan. She just did provide the link to our VIP portal. And again, once you're logged into the VIP portal, on the top left-hand side, you'll see a button that says University. And this training, among a lot of other training for the MedicareCENTER, is going to be held there. So if you don't have access to it, feel free to request access. It'll come to us, and we can improve that so that you can get in there as well for our agent partners. So what I want to get back to real quick is just showing you the ability to be able to pull information. So I'm going to go to continue to plan, basically just running a basic quote here. And you can do so by just selecting plans as well. So we're looking at the 28708 area. And what you can see here, we have prescription drug plans, but we have Medicare Advantage, MAPDs, and DSNPs are found here. You'll have to toggle to access DSNPs, MA-onlys, and PDPs. Now, all 3 enrollment systems within MedicareCENTER offer these resources. They look just slightly different, but all these resources are offered. Again, you can see this is my information. It was just a test case, so we don't actually have a PHI out here. But again, I had selected providers, where you can see that information. Prescriptions, I had just entered a basic list, and you can see whether they're on the formulary or not, as well as the pharmacy that the member goes to, so you can see if it's preferred, standard, in or out of network. And then the systems will actually show you the estimated annual drug cost for prescription drugs. If you're in MAPDs, it'll actually show you the total estimated cost, which includes an estimated or monthly health cost. And what that is basically the carriers providing data to CMS that we have to then provide because it is public, or it's required to be shared with consumers. What they do is they look at the member demographics. So basically, let's say that Mr. and Mrs. Jones was between 65 and 69, and they live in X zip code trying to apply for this plan. What the system will do is it has 3 averages. It's for healthy, mildly healthy, and unhealthy folks. What the average cost per month for health costs were for that member pool for the previous 2 years in that area on that plan. So is it specific to the member? Absolutely not, but it gives both you and the member a good idea of what the average costs were for members on that product the year previous with that type of health scenario. And that is added in the annual cost, because what you'll notice here is the deductible for this plan is 0, the monthly premium is 0, okay? So why do we have, an estimated cost when the estimated drug cost is 0 as well? Well, that's actually going to be that monthly estimated health cost that's been included in there. You can see a breakdown by going to plan details on any of these as well. And again, all this information can be sent via quote to a member, or it can be done face-to-face so that they can see all this information. So you can actually see a breakdown of prescriptions, what tier they are, if any are in selected care, costs, things of that nature, as well as total costs. Will then give you a breakdown month by month. And again, keep in mind, this is only for 2022 plans, what we're looking at currently, so it only gives you an effective date selection of October, November, or December, and then we'll adjust costs appropriately. After the update for 10.1, you'll still have access to the 2022 system, and you'll then also have access to 2023 business. And when you're looking at the 2023, it'll actually auto-populate to January 1st and show you the full 12-month breakdown. And then within that breakdown per month, you'll see the drug name, the phase where it falls, and drug cost as well. And then you can also see a breakdown between the premium, the drug cost, and that estimated health cost shown there. So again, if we're talking to Mr. and Mrs. Jones in this scenario, we have no way of telling the future of what may happen, but what we do know is what the premium will be, what their drug cost will be, and then we can discuss what their PCP copay may be, or their specialist copay, or if they run into this scenario, what would it cost them? And then we can provide that information from there. But to be able to see details or be able to pull documents on a specific plan, again, you can select plans, enter a zip code, and then to get to the right county, and then select that plan. Or if you're actually looking at a member specifically within here, and they have questions about their plan, you go to their profile, go to the plan that they have, and then on plan details for said plan, you scroll down to the very bottom, and what you'll see, plan documents. Each carrier determines what they're going to release for plan documents, but at least the required compliant information is provided here. But we can see for the summary of benefits for this plan, I simply click on it, and in a new tab, I have the current PDF of that summary of benefits that I can download, I can send to a member, I can search myself. And again, we can see the evidence of coverage here as well. Like I said, each carrier is slightly different. You will notice Humana is going to have the most available documents to be able to pull, and they actually do both English and Spanish, which is really nice. So they have a ton of stuff that you can be able to pull. I get a question, is there a disadvantage in using MedicareCENTER for enrollments over carrier e-apps? That's a fantastic question. I may be a little partial, only because I've spent a lot of time with the system, spent a lot of time with our agent partners, training them and helping them become more efficient using the system. What it comes down to for me is, do you need to learn a new system or each carrier's protocols, including the login credentials, to be able to access their e-app? And again, how do you know if you're comparing separate plans, which direction they want to go until you kind of get to that discussion, versus using MedicareCENTER where it's a single location. You can compare plans against across carrier lines. So I could look at a Blue Cross plan, Humana, and Aetna if I wanted to, just for example, and be able to compare that, send it to the member so that they can compare it as well, so that they can then make a decision on which plan they want to purchase and move from there. And again, single login, and it doesn't matter what type of product you enroll in through the system, every single one is exactly the same. So once you learn how to use this system, it's wash, rinse, and repeat. You don't have to learn something new for each carrier or each product type. It is the exact same method. So again, once you figure out how to do it, it's very easy to repeat versus having to go to each separate carrier portal, know your login credentials, and then the systems required or the actual step-by-step process to go ahead and use that as an enrollment tool. Again, this is a one system versus multiple. But again, it's up to each agent on how they want to use it. This is not a required product to be able to use if you're partnered with Tidewater or in a different integrity partner. However, this is a tool that, again, that is at no charge to you. You receive full commission and comp based on your existing contract, and it's for ease of use. I'd prefer to learn one system versus multiple. But again, it's up to everybody there. Do the plan details include the extra benefit amounts like vision, dental, hearing? Not just mention that the plan does not cover the item. Yes. So, and you can actually filter when you're going, depending on which enrollment system, it looks a little different, but you can actually select plans that either have Part B givebacks or dental, hearing, vision, any of those things. You can actually make that selection. It'll highlight those benefits. And then when you actually look at plan details for the product, right? So we're looking at comparison, and when you select plan details for whichever product that you're looking for, it'll then highlight whether there's a give back, if what the dental benefits are, hearing, anything like that. So I got a question. Won't we still need to leave MedicareCENTER to enter Blue Cross Blue Shield apps in their agent portal? So if we're Blue of North Carolina, Blue of South Carolina, no, you do not need to. You can do it in this system, and that's transmitted directly to the carrier. They don't require it. Same thing with SilverScript. If anyone's using SilverScript for their PDPs, if you're familiar, either they have an e-app that you're going to upload. It's a single step, or if you're taking paper with them, basically you have to enter that data into the agent portal and then upload a copy of the app with a confirmation number for everything to be compliant. If you use this system instead, it's just a one process. You don't have to worry about uploading anything there. Dwayne, I'll have to get back to you on that one specifically. I don't know that that one is available in MedicareCENTER only because we don't have access to it here at Tidewater, but I believe some integrity partners may, so it would be available. So I'll get back to you on that one specifically. Can we use this offline for enrollment and then place once internet is available? Not currently, unfortunately. You have to be connected to internet to be able to use the system, again, whether it's a hotspot or data connection on your phone or iPad or laptop, or whether you're actually at your desktop. I haven't got a definitive answer on yes or no, but I expect the way that the systems are being updated, that is going to be a possibility in the future. But currently, no, it is not. And I don't have a time frame on when that may be the case, but I certainly expect and hope that that is going to be a solution that's offered in the future. And again, folks were asking about the HRAs. Yes, as long as you are certified and approved to compliantly do them with the carrier, every HRA that's offered through the systems are there as well. Okay, in Medicare app, do you know how accurate the provider's function is? Can we rely on it? Okay, so great question. So you can add drug lists, you can add providers, as well as pharmacies, specific locations of pharmacies, basically anywhere in the country for that member. These systems are subject to carrier data. What that means is our provider lists are only as accurate as the information that the carriers provide to us. We have seen previously where some of that information is either out of date or is not current for the provider specifically. So you can still search for them and add them, but you may see that they're being shown not in network when they actually are. What I recommend everybody to do is, if you were to ensure provider accuracy, always go to the carrier provider search and confirm that they're in or out of network. That is the only additional step that you would ever need to use using anything within the MedicareCENTER system. And I know that we're working on making that more functional and up to date, but again, we're reliant on the carriers to provide that. And as you guys know, it can be a challenge, especially when there are so many different carriers that want to do their own, either grant specific access or want to do it their certain way. So get everyone to kind of work on the same page and provide that information at the same time can be challenging, for sure. So for providers specifically, and again, thank you for that question, I always recommend going to the carrier provider search and verifying that they're in or out of network there. Now, again, this system will, whether it's Medicare app, Medicare Link, or the CRM, will give you access to, or will allow you to save providers. So again, even if you're going to do an enrollment in an e-app somewhere else or a paper app, you can still retain that information for Mr. and Mrs. Jones. So from year to year, you already have that data saved in one location. But yes, you absolutely want to verify that information. Now, when it comes to drug costs, pharmacies, plan details, that is all up to date and current. Again, it is only for providers that you should take that one extra step and ensure that they are in network based on the provider search. Yes, Deborah, alignment will be within the system for 10-1. It will be there. We're still waiting on finalization there, but again, because we're not doing 2022 products there, it'll come with that 10-1 update. And keep in mind, folks, when I say 10-1, that is when we launch our large update. It's a Saturday this year, and anytime that a large update is given that's across, nationwide to a lot of folks, inevitably there may be small hiccups from time to time, whether things aren't loading correctly, you may see that you're missing carriers or something like that. Be patient, give us a couple days. Last year, when we launched our 10-1 update, I think it took, it was within the day, everything was corrected and taken care of. Unfortunately, there are just some things that you can't test prior to you launch, and then we just kind of troubleshoot from there. But yes, there may be a day or two after 10-1 where things may not be working appropriately. Again, keep in mind you can't actually do enrollments at that time, so you don't have to worry about missing out on opportunity there. But that information will be corrected as soon as possible if there are any issues like that. So again, we appreciate your patience when it comes to those things there. So let's see, what else do we want to cover? Does anyone else have any other questions? I appreciate you guys all kind of chiming in with both the Q&A and the chat. We will be covering a lot of this information in much more detail, like I said, in the next few trainings. I just want everyone to be familiar with the basic system and what they can see. What's really cool here, and before I leave, under the Learning Center, there are going to be how-to videos, user guides, there's going to be tech manuals, how-to guides, call scripts, as well as sales tips. You can see working remote. Carrier guides are constantly getting updated. And there's going to be a lot more information available after the 10-1 release as well. So again, whether you need help with Medicare app, with just looking at their training hub that you can see, the Medicare Link technical guide, I'll show you some of the other ones here as well, the CSG tech guide, this Medicare enrollment tools carrier comparison chart. It's a mouthful. However, this will actually show you all the carriers that are available for each system. What I can tell you right now, Medicare app has a lot more carriers than Medicare Link. Medicare Link has the major carriers, but a lot of the local or regional players aren't necessarily within that system, but both national and local carriers can be found in Medicare app and the CRM. Again, the HRAs as well can be completed in Medicare app and the CRM. Now, the live call options are probably going to be best served by using the CRM, again, because that is something that Integrity has created out of whole cloth. We're not working with a third party on the enrollment platform or enrollment engine on the back end, so it gives us a little bit more custom ability and access and control to make updates as we see fit and do so in a much faster way. Is there a playground area for MedicareCENTER that we can use? There is not a sandbox, but you can use your active portal to what I recommend doing is creating a profile in whichever enrollment system you want to test out, whether, again, it's the CRM and our contacts, Medicare app or Medicare Link, where you literally create first and last name. I think I made one testing McTesterson is what I ended up doing. Something that you know isn't a client, where you can actually enter profile information. You can send an SOA to yourself via email or text message to be able to test that out. Just don't submit the scope or the application if you're going to send something to you to see, because it is live and will actually get delivered to the carrier. But up to the submission point, you can test everything out on yourself so that you can see what it looks like from both ends. And I actually recommend doing that, especially if you haven't used the system before. That way, if you're doing again, whether it's face-to-face or over the phone, you'll be familiar with what the member is seeing on their end, so that if there are any issues, you can troubleshoot it kind of on the fly there as well. Okay, did you say that clients need to call in to us on an assigned number in order to activate recording, or we just press a button? More to come on that one. That is a great question, and we'll cover that at length here very soon. I'll discuss that next week's training, or we'll provide an additional training just for the call recording function to make sure that we kind of show it beginning to end there. I don't want to tell you the wrong thing. Basically, there's a button where you can turn the phone number on and off so that you're not receiving calls when you're not prepared to do so. However, if you want it to be recorded, you either need to prompt them to call that dedicated phone number that you've been assigned today, or you call out from that number for that recording. A great question there. Do I have any other questions from folks? I know we ran through kind of a lot of stuff, jumping around, but again, I want to make sure that everyone is aware of this system, know that they have access to it, and can at least get registered to make sure that everything is in place for 10-1. And again, more to come in the next few trainings, but we, again, appreciate everybody joining this training today and asking so. Is there a browser preference for MedicareCENTER? Good question. I prefer using Chrome. I have not had any issues there. I think all the major browsers work without any issue, but I do know that Chrome would probably be the best to do so if you have it. But again, yeah, fantastic question there. And if you folks run into something specific, whether it's technical or you see something that you have questions about, again, feel free to reach out to myself or any of the TMG staff here, and we can troubleshoot that. Hey, Tommy, which app do we use for phone calls, app, link, or CRM? I believe the call section is only going to be found within the CRM moving forward. I'm waiting on testing everything out. Again, this just went live this morning. I haven't been able to actually get in there and try and break it myself, but I believe it's going to be in there, but we will discuss that in much more detail to come. But what I can tell you, I guess the last thing for one of the updates that we're going to see for 10.1 is there's going to be an app that you can download for your phone or iPad. You go to your app store and you download the MedicareCENTER app, and you'll actually be able to use your phone basically to call in and out of on the app by selecting that phone number there and access your entire system using the application as well. Did you say the Medicare Link or app has the most carriers? So Medicare app has a lot more carriers than Medicare Link. And again, you can go to under Learning Center, and if you scroll down under Tech Guides to where you see Medicare Enrollment Tool Carrier Comparison Chart, that'll actually show you every single carrier that's offered via Medicare app, Medicare Link, and the CRM. Pearl. Okay, so for folks that want to see a Pearl, again, it depends on which system that you're in, but you're going to go into the account section of the enrollment system that you're using. So whether it's Medicare app, Link, or the CRM. So let's say I'm going to be in Medicare app for here. I'm going to go ahead and go to account. So within Medicare app, you can be at the home screen. Oh, there we go. I'm going to go ahead and select account overview. And then you'll see my shopping link, copy link. And again, that can be embedded in your signature. For an email, it can be added to your website, or you can send it out to people directly. Now, these are year specific. So again, the link that I just copied from this account is only for 2022 products. After the 10.1 update, you'll need to go into the 2023 section of the enrollment systems and go to the account information and copy that link so that carriers can go ahead and access the 2023 products. If we have a totally different CRM for our clients, can we still use a recording tool to satisfy the final rule? Yes, so you can use the recording tool even if you're using another CRM. However, I recommend creating a profile in this system to do the recording so that when the recordings are finalized, they are automatically thrown into that profile. Again, you don't have to have all the information in that member's profile, but enough identifying factors so that you can tell who that is so that you can then have the corresponding information in your CRM kind of connect there, so that you can match that information. But the cool thing about these recordings is after you've added the profile and receive calls from that said number, every call moving forward from that number is automatically, once it's saved, is thrown into that member's profile. So you don't have to actually every time say hey, it needs to go to here or to there. The system is intuitive and knows that information. Again, I'll go over finding the Pearl again for Medicare app when you're at the home page. Actually, when you first go into Medicare app, this is what you're going to see. You're going to see the search for beneficiaries. You select your name, go to Account Overview, and in the next window, you'll see Copy Link. And again, you can scroll down and actually see your active selling permissions that are available within Medicare app, for instance, or you can do the same thing with Medicare Link or the CRM and be able to have access to that information. But again, with this link, a member can enroll in any product. Let me say that again, any product that you are authorized to sell through the system. So that's MA only, DSNP, PDPs, MAPDs. So I recommend only providing that resource to folks that have already done their own research and are technically savvy enough to be able to make that decision. You don't want to run into a scenario where a member thinks they're rolling into an MA only and enroll into an MAPD, or try to enroll into an MA only and a PDP, and end up being placed on a product that they didn't intend to, because that'll cause a lot of additional support and inbound inquiries that you'll have to take care of. So just keep that in mind. Make sure it's used for only folks that are technically sufficient enough to be able to make that decision on their own. The cool thing about when you're using this Pearl, and the last thing I'll say about that, when you're using the Pearl, and if members access that and try to enroll into as soon as they try to enroll into a product, if they get stuck anywhere, at the top right-hand corner of their screen, they'll have some information, including your contact information. And right below that, it'll actually give them a code. They can read that code to you, and when you're at, when you're in your system, there'll be a spot for you to enter that code, and it'll actually plug you into their application at the time that they stop. So you can see here a personal code. So let's say a member was using the Pearl and somewhere down the line got stuck in the application and needs help. When they select your contact information and call you, there's also a code just below that. You'll enter that code here, and that'll put you right into the app at exactly the same point that they are, so that you can help them move on and not have to start from beginning to end, or try to have a member explain what they're doing to you, because we know how that ends up going up. So for ease of use, it's fantastic. If you meet face-to-face, does the enrollee still need to call you for recording to be compliant? Absolutely not. If you were meeting face-to-face, you do not need to record it. Now, it may be a good idea if you start implementing that just as a protection for both the member and yourself moving forward, but not required. It's only any sort of phone call that you have that we're talking about recording. But if you're meeting face-to-face, whether it's a walk-in appointment, if you're doing a sales event or something like that, you do not have to record those calls. Obviously, you still need to be compliant, collect the scope, go through a compliant sales presentation, provide all necessary material, things of that nature, but it does not need to be recorded. But what I've been telling a lot of folks, and it may be a little bit of overkill, but because these systems are in place, and there is still a lot of questions about, do I need to record this, or should I, or do I need to record this call, or if I'm just setting an appointment and it's something else discussed, do I have to then record? What I would try to remember is just get in the habit of recording every single call. That way you don't have to worry about whether it's part of the compliance that just came out and has to be recorded, or if it's something that isn't. If you record everything, you've covered yourself and can then retrieve it and send it. And that way you can kind of build a repeatable model that you can do with every single member and really kind of get efficient and quick with those. And that way you never have to worry about it. You just know that at any time that you're on the phone with either an existing member or prospect, everything is recorded, and you can ensure that you're compliant. Again, if the member refuses to be recorded or retracts consent to do so, and you select the button to stop, you don't have to record anything beyond that point for that member. It's a great question there. Can clients leave a voicemail? That is a fantastic question, and I do not have that answer right now, but I will be happy to provide that to everyone as soon as I get a definitive answer there. And I apologize for not knowing that already, but I will verify that and let you know. I'd assume that would be a function, but I do not know definitively, so I will get back to everybody with that answer there as well. Great question. Let's see, I want to make sure that everything else. So for first-time user of MedicareCENTER, where do you suggest we start? If you have not ever used the system, I recommend starting with the CRM. The reason I say that is because for you to upload a book of business or upload your client member information, and a lot of the updates that we're going to see here in 10.1 are all happening with the CRM, and I expect that we may be moving in the future to that system more than others, only because we have more control over it. that would be a great place to start. For folks that are accustomed to either using Medicare app or Medicare Link, you're still feel free to do so. But again, most of the updates, again, because we have control of the CRM, are going to be coming in the CRM. So it may be a good time either way to get familiar with and start using the CRM moving forward. Again, we still have some questions, and I'm working on trying to get answered, and I will let everyone know at that point kind of the specifics there. So thank you very much for everyone joining today and all the questions. Again, if I missed any, I apologize, but we will get those back to you as soon as we have those answers there. So again, thank you everyone for spending some time with us this morning. Thank you for your partnership with Tidewater Management Group. Again, we wouldn't be successful without you folks. We really appreciate giving us the opportunity to earn your partnership every single day. And have a wonderful rest of your day, and we will talk soon. Thank you very much, and God bless.